Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video, I'm going to be telling you the top 7 reasons that you should exercise during and after breast cancer. So if you enjoy this video and you would like to see more, please subscribe to my channel, which is completely free. Leave a comment in the section below so I can find out what topics around breast cancer you would like more information on. And if you like this video, give it a big thumbs up because it sure helps me make more free videos for everybody out there. Alright, so without further delay, let's get into this video, the top 7 reasons why you should exercise during and after breast cancer. So reason number 1 is to combat the side effects of breast cancer treatment. As everyone who's been diagnosed will start to understand, or people who've been through it will know, is that there's a ton of side effects that hit you when you get treated for breast cancer. And one of the best ways you can get through your breast cancer experience is to manage those side effects. So as an example, if you get really fatigued when you're going through chemotherapy or radiation, one of the best ways you can combat fatigue is to exercise during chemotherapy and radiation. And that comes as a bit of a shock to people. What we used to tell people a long time ago was to rest, was to basically put their feet up or lie down in bed and not do much at all. But lots and lots of research, and I'll put some links in the description bar below to some of that research, is very strongly advocating that exercise is very beneficial in combating fatigue when it comes to breast cancer treatment and specifically chemo and radiation. Another reason exercise can combat chemotherapy side effects is for nausea. So a lot of people get really nauseous through chemotherapy, and exercise is a great way to combat the nauseousness. Another really common side effect of treatment would be weight gain. So there's a lot of people who have gained 5 to 10 kilos or more through their breast cancer experience. And if you're exercising, that's a really good way to help maintain your body weight. Even things like fluid retention throughout chemotherapy, if you're regularly exercising, you're helping flush your system. And that's also going to help combat the side effects of the steroids that people often get given through chemotherapy, which is increasing fluid retention in your body. So if you're helping that system to flush regularly, you're also flushing the steroids through, which is also relieving that problem of fluid retention. Reason number 2 for exercising during and after breast cancer is that exercise can help maintain or improve your muscle mass. So one of the biggest issues from breast cancer is the effects of deconditioning, which literally means that you lose muscle mass and muscle strength, and you can also lose bone stock. We'll talk about that in another topic in a second, but specifically losing muscle mass and muscle strength is a really big issue. This will literally mean that your physical capacity gets impacted as a side effect of breast cancer treatment. So picking things up that are a little bit heavy or going for a walk can become tasks that are a lot harder for you if you're not maintaining exercise during breast cancer. There's also a lot of people though that I see who have completed their breast cancer months or years ago, and they're still feeling the effects of not being properly physically rehabilitated after that experience. So if you've finished your breast cancer treatment and you're still feeling like your body's gone to mush, if you're going through breast cancer and you're feeling that, then exercise is a fantastic way to combat muscle mass loss and muscle strength loss. The other thing I want to quickly mention here though, guys, and this is quite important, and I've mentioned this in another video I've done recently, is the idea that there's a lot of women that can look quite slim, but they're more made up of fatty tissue and skin rather than skin and muscle. So one of the best things you can do is get a body composition analysis test done to see how much fatty tissue, muscle and fluid you're actually made up of, because it is surprising how many women might look slim, but they've actually got very little muscle on them, and muscle's a really important body composition element that you need for energy and strength. And I know that stuff sounds obvious, but unless you're actually doing exercise to maintain and promote muscle growth, then you can be slim, but you might have very low muscle stock, which is a problem. Reason number 3 to maintain exercise during and after breast cancer is because when you go through breast cancer, and particularly if you've gone through chemotherapy or you're on hormone blockers, depending on the hormone blocker, you can be at higher risk of low bone mineral density. So the technical term for low bone mineral density is osteoporosis. The precursor to osteoporosis is called osteopenia. So there's a lot of elements about going through breast cancer that put women at higher risk of having low bone mineral density, such as chemotherapy can make you twice as at risk as the normal population to have low bone mineral density. But then the other factor is that a lot of women who get diagnosed with breast cancer are already postmenopausal, which means the estrogen is not as high in your system, which can impact your bone stock. And then the other thing that can impact your bone stock is hormone blocking medication. So these are the oral tablets that often get given to patients who have got a estrogen positive breast cancer. And some of these medications can impact your bone stock. So one of the best ways you can combat lowering your bone mineral density is resistance exercise. So this is lifting weights and at least doing weight-bearing exercise like walking. So I'll put a link in the description bar. I'll put a link up here, to one of my videos, which is called Upper Body Strength Exercises After Breast Cancer, so that you can at least go and have a look at what you could get started with if you're interested in combating bone mineral density. Reason number 4 for continuing exercise during and after breast cancer is improving your mental health. Now, as you can imagine, guys, this is another topic that's super dear to my heart. I think there is nowhere near enough people referred to mental health professionals during and after breast cancer. There is a huge amount of fear, stress, anxiety, depression, anger, overwhelm that comes with a breast cancer diagnosis. And so if you know that exercise can make you have a massive endorphin release and make you feel a lot better about yourself, that would be the number one reason I would encourage people who've had a breast cancer diagnosis, whether it's yesterday or whether it's years ago, to exercise. Endorphins are our happy hormones, and when we exercise, we usually get a big release of endorphins. The other reason I think exercise can really improve your mental health when you're going through or following breast cancer is that exercise is usually taking you into an environment where you're not in a clinical setting anymore. So it's usually away from a hospital, it's away from a doctor's office, it's away from a scanning machine. So if you can take yourself outside for a walk, ideally, being surrounded by nature or near the beach, just getting fresh air, being amongst other people who aren't cancer patients, or even going to a gym where there's a lot of other healthy people around you. Now, I know that some patients who are going through breast cancer will be cautious about going into spaces where they could catch infections, and I'm certainly saying err on the side of caution with where you go to exercise. But if you can do it safely, or if you can do it in a gym that is geared towards patients going through things like cancer, then one of the loveliest comments that I get about the gym at my clinic is that it's away from that real medical sort of setting. So that's one of the reasons I believe that exercise is a fantastic thing to do during and after breast cancer. The other thing I'll quickly mention, of course, on the topic of mental health is that exercise can also reduce the impact of brain fog. So we used to call brain fog chemo brain, but what we've realized through a lot of research is that brain fog can happen with more than just chemotherapy. So this is the issue where you can start to be very forgetful, or you can lose words. You can just have trouble sort of with cognitive function, generally speaking, when you're going through treatment for breast cancer. So they have shown that exercise, which is enhancing blood flow, including enhancing blood flow to your brain, can reduce the impact of brain fog. Reason number 5 for exercising during and after breast cancer is that it can improve your energy levels. Now, another way to say this, guys, of course, is that it reduces the impact of fatigue. And that's probably a better way to say it, because at the end of the day, people hate being really, really tired all the time, particularly when they finish their treatment and they're weeks or months out and they just want to feel a little bit of energy. And one of the things that I hit commonly in my clinic is this idea that people think that exercise exercise needs to be, red-faced outside in heat and humidity, or freezing cold in the rain with, snot pouring from their nose and their eyeballs popping out of their head and their heart rate racing. That doesn't have to be how you start to exercise. If you're really fatigued, trying to do exercise when you're super tired is like a contradiction of terms. So one of the reasons I've put that link to that exercise program, upper body strength exercises after breast cancer, is because that style of exercise is a fantastic way to get the ball rolling if you are really fatigued. So reason number 5 is improving your energy levels, and I believe that this is one of the best things you can embark on as to a reason why to do exercise, is because if you've got great energy levels, you're going to feel happy, you're going to feel functional, you're going to feel slightly normal again. I know that saying feeling slightly normal again is a little bit sort of controversial when you're going through breast cancer, but the more normal you can make yourself feel, the better. So find a way to start exercising rather than having this vision that exercise has to be running a marathon at some sort of really crazy high intensity, because there's lots of versions of exercise, such as a gentle yoga class or an aqua aerobics class, or just walking around the block to start off with. But I can guarantee you that whatever you start with is going to be better than nothing. And certainly the other really important point to make here is that all of the research around exercise and breast cancer is really advocating the idea that being sedentary during breast cancer is actually considered now dangerous. So I will put a link to the COSA Position Statement on exercise and breast cancer, because that's a really fantastic research summary of all the work they've done looking at the impacts of exercise on all cancers in actual fact, but they do talk a lot about breast cancer in that position statement. And it really advocates the idea that if you're sedentary, you're not doing yourself any favors. If you can do a couple of moderate intensity exercise sessions in the week, you're doing yourself a huge benefit. Reason number 6 for exercising during and after breast cancer is lymphedema prevention. Now, lymphedema is a nasty side effect of breast cancer treatment, where if you have lymph nodes taken out of your arm, you're at risk of your arm developing a chronic swelling. So as you can imagine, a lot of people try very hard to prevent lymphedema. Now, I will put a little caveat in here, guys, and I will put a link to one of the videos I've done previously, which is going to walk you through how exercise can actually trigger lymphedema, which sounds a little bit ironic here because I'm saying that exercising is a really important part of combating the side effects of breast cancer. But there is something to know about when and how you start exercise when it comes towards lymphedema prevention. So follow the link that I just put up there, because that's just an important little piece of knowledge to know. But as far as exercise and lymphedema prevention is concerned, doing regular resistance training, and when I say regular, a couple of times a week at moderate intensity, has shown that you can reduce your risk of lymphedema starting by over 70%. So that's based on a research article or research study that was done over 10 years ago, but it was a super duper research project, and it was so powerful in terms of reducing risk of lymphedema. The other thing that study found, though, was that if you exercise if you have lymphedema, you can also reduce your risk of flare-ups of that lymphedema by over 50%. So exercise can actually help you prevent and manage existing lymphedema. Reason number 7 for exercising during and after breast cancer is reducing your risk of breast cancer recurrence. Now, this may sound too good to be true, but the more research they do on exercise when it comes to breast cancer, it seems to keep giving positive results. So they call these studies epidemiological studies, where they look at people who have had breast cancer previously and they follow them over time. And what they do is they compare people who have exercised after they've had a breast cancer diagnosis to those who haven't. And there's very strong statistics coming out to show that you can really make an impact on reducing your risk of recurrence if you are exercising regularly. And it doesn't matter if you've never exercised in your life before your breast cancer diagnosis. If you can start doing any sort of exercise, you are going to make an impact on your recurrence. And if you can do moderate intensity exercise a couple of times a week, you're going to make a big impact. And by big, I mean 50% or higher. So these are the sort of statistics that are starting to come out now. I'll put another link to a research article that recently came out about the impacts of exercise on breast cancer. So please, please, please consider how you can get started with exercise. I think I've just been inspired to do another YouTube video, which is probably, along the lines of how to get started on exercise when you have lost your motivation, because it is incredibly common how many women will say to me they've just lost their mojo. They know they should be exercising, but they just do not feel like it, and they don't really know how to start. They're not sure how to start safely, and they're not sure what they can do and what they shouldn't do. So I'll make sure that I make a video on that very soon, how to break through your mojo when you're trying to get, into an exercise regime again. Thank you so much for watching, everyone. I hope you've gained some great information from this video. If you have any questions about exercise and breast cancer, please leave a comment in the section below. I'll be back here next Tuesday with another video, and I hope to see you then. Hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.